We've had more than 46 million cases. And even now, COVID community transmission is either substantial or high in every US state. But bars and restaurants are open, people are heading back to work and school, and the US goal right now is really focused on getting a lot of the population vaccinated. At a Senate committee hearing last week, Dr. Anthony Fauci sketched out a vision for where this all leads.
So if we get more people vaccinated globally, hopefully within a reasonable period of time, we will get to that point where it might occasionally be up and down in the background, but it won't dominate us the way it's doing right now.
Dr. Fauci testifying there last week, and I know when we had him on the show last week, I interviewed him on Friday and asked, is there a number that he keeps the closest eye on to gauge where we are in all of this? Is it reducing case numbers? Is it reducing deaths? Is it getting more shots into arms? He said all of the above, that you can't do any of it in isolation. Does that square ping with what others tell you as you're reporting?
It is a little bit of everything, but the emphasis on each of these things changes depending on the phase of the pandemic we're in. So health officials say that they've been thinking a lot about what an endemic phase looks like, and they say that they're modeling it on flu. So in terms of what that means less of a focus on case numbers, more of a focus on severe illness, hospital capacity, and deaths. Some health experts say we should also be tracking long COVID cases, especially the severe ones, but we are still not in that endemic phase yet. There are more than 70,000 cases a day in the US, and health officials have said that getting that number below 10,000 a day would mean that the virus is under control. By those metrics, China has the virus under control, but US officials mean sustaining that low level of cases with people going to school, to work, enjoying travel and leisure, so the US is still a ways off from that.
John,